So we'll turn it over to Gary.
Well, and listen, I thank everybody for coming, and I've been here a little over a year. I know everybody in this room, I think, and you know, a lot of us were veteran a lot of campaigns, good, bad, and ugly, but I'm happy to be here. This has been a good place for me. Basically, after my last place, and I'm tired of this stuff, so I'm just going to go to my office, my Alamo, just work there. And they called me up and asked me to come here, and I'm very happy to be here. So it's a good, solid place. You know, just a couple of things here too. Is that, and we'll get into this, but I just want to cover some ground here tonight I think is helpful, because psychiatry has always been kind of splintered. And we have different schools, and you know, mind-brain dilemma and all this kind of stuff. And gosh, I remember reading papers by Arietta and Searles up in Chestnut Lodge, and I don't drug my patients. I have schizophrenics in analysis 4 days a week, and 12 years later still doing word salad. You know, so how do you make all this stuff fit? Go, well, the mind and brain are separate. They're all in the same skull, by the way. I've actually been in there doing brain surgery. So the idea that they're separate is foolish. So it's a matter of how do they connect. And so we're going to talk about that some tonight. You know, the greenhouse is a fascinating place. When I was a kid, we always heard about the rich and famous people here. Now, I will tell you this, I'm not supposed to, Shay will make it mad at me. For a nickel, I show you where Maryland Rose stayed. So I asked that when I got here. So, but it's actually the best room in the house. What do you think? But it was, can you hear me? Okay, all right. Okay, yes. I mumble, and I talk in metaphors, and I have a low voice tone. So I will try to be clear. Is this better? Okay, anyway. So the history here is useful because we inherited this nice building. That's kind of the whole point, that we inherited a really good building, looks good in the brochures. People ask, why are we so successful? If you have $85,000 a month to spend, I can send you some places. They'll give you a foot massage, and they'll play your tune on the flute at dinner. The recovery's no better. I tell people this place is, for the insurance places, and this is this on? There it is, okay. We are adequate plus 2 notches. That puts us above everybody else around here. That's why we have so many patients here. We have 130 in-house, about 140 at the day hospital. There are 3 doctors. There's me and Valerian Day. You probably know most of them. I have 5 nurse practitioners. We have 4 internists. We're an army. Every patient's needs must be met every day. So part of the arrangement is make sure everybody gets taken care of. Solid recovery, good basic psychiatry. And to fill in something that Phil was talking about, the treatment programs here are structured for 1 year. And the reason it's 1 year is because it's not till 1 year that the statistics change. If you're sober a year, like you know, the brain injury, your brain will switch. The pleasure centers quit clicking as much. We'll get into that. This is working and not working.
Really close.
Yeah, Cheryl is.
Are you a tech person?
1 to 2.
Okay, got it. All right. Is that too loud? No. I don't know. Okay. Okay. So again, the title of this talk is the role of psychoanalysis in the current practice of psychiatry and addiction. Now, that's just not terribly different than most other talks of this sort. People ask me why I had so many credentials. It's because I kept seeing patients I couldn't treat. And so when I was at Timberlawn back, good Lord, started there in '79, I was on a tertiary referral unit. You had to fail at 2 other units before you got to us. And we had treatment failures. And treatment failures, I'm not going to use this. Let me try it again.
Just keep it within 1.5 inches of your mouth.
Okay.
It's hard to do.
All right. I'll do my best. Okay. Treatment failures meant they'd been in 2 other inpatient units and failed. And we kept having to come up with, we go, well, we're going to treat them like this, we're going to treat them like that. And it turns out that we very often have to create a program for that person. And so that's just what we're going to get into with this. You know, I always tell people, because how do you go into psychiatry? When I went to college, there were 3 questions I couldn't understand. And I don't understand them yet. How did the universe come into being? That's a very good question. You get interesting discussions on that. How did life form on this planet? I have a degree in biology. Why do we think, feel, and act the way we do? That's a really good question. And so you get into many things that to get people stirred up. Is this deity driven? You know, is it one of the 5 major religions, 6,000 gods currently being worshipped? Did they control this? Or is it, I always like Francis Crick. You know who Francis Crick was? Anybody know who Francis Crick was? He was a code breaker in World War II, really smart guy. Worked with Turing on the Enigma code. While he was at Cambridge, he and Watson discovered the shape of the DNA molecule using a chalkboard and pieces of paper. What he always said was, to have the origin of the universe, to have life on our planet, and to think, feel, and act, you need Newtonian physics, basic chemistry, and biology, and time, and unlimited energy. So these are the two models we look at. Now the principle of what forces come together, I always like reading Welder. I mentioned Welder. Anybody know who Welder is? He was an engineer who became a Freudian analyst in the 30s. And he wrote a book and he described the principle of multiple function. And that's probably the groundwork of this. That he would say, if you built a bridge, the forces on any joist or bolt were determined by the different pieces of metal and the angle they were bending and the weight of those pieces of metal. What he said in psychiatry, any symptom, which is an iceberg tip, with multiple forces created that symptom. And you must understand all the forces. So that's kind of the basis of this. So I'm going to talk a little about how does theory work. Now before we do that, since told Danny shouldn't be a microphone, I'm going to quote from one of my favorite books. Did anyone ever read Zen and the Art of Motorcycle Maintenance? I'm so happy. I feel so affirmed. About a guy who was a professor of classical Greek rhetoric who had been psychotically depressed and got ECT and lost his memory. He recompensated by riding a motorcycle cross country with his son. There's a line from that book that I quote a lot, and he said, he's describing how people treated him when they found out he had ECT. And he said, when people saw him, he was insane. And when you look at him, all you know is all you see is your knowledge that he is insane, which is not to see him at all. To see him, you must see what he saw. You must take an oblique route. Not even the opposite of that. We're going to talk about like bug in the lab. We're going to break down how diagnosis is made. To do that, you start with the book I still like, and Dan probably has a copy of this, Karasu, the Psychiatric Therapies. You might have a copy of that? No? 3 volumes. Karasu, I met him, an interesting guy. In 1989, they sent him out to American Psychiatric to study psychiatric therapies. He found there are 150 schools of psychiatry in the United States, each with active practitioners, an internally consistent theory, and testimonial evidence of cure. 150. He said they broke down into 4 schools. So let me tell you what the 4 schools are, which is still accurate and correct. Number 1 is objective descriptive. That's the oldest school of psychiatry. You get a list of symptoms. That symptom complex represents an illness. You get a treatment plan that will treat that illness. It's mainly based on neurochemical disorders. It predates Freud. Anyone read your Bloiler in training? Please tell me you did. Thank you, Jennifer. Bloiler was a Swiss neurologist who brought schizophrenics to his ranch. He's a rich guy in Switzerland and studied them for 30 years. And described, by the way, the conduct inhibitions schizophrenics have, described how they, when they got older, they developed spontaneous dyskinesia. He didn't know what it was. By the way, that's something interesting to think about. And in the 50s, they had multi-organ failure and died. Anybody treat schizophrenics? Pretty accurate stuff. The second school, and by the way, National Institute of Health, not mental health, National Institute of Health, 25% of people have a genetically determined mood disorder. 18% have anxiety disorder, 13% have depression, 12% have addictions, 3% have bipolar, 1% have schizophrenia. This number holds up over time. And we'll get into that as we talk about it more. Psychoanalytic school said it was born with Freud, sort of. You ever read your Voltaire or Marcus Aurelius or Constantine? People have been thinking about this for a long time. or Homer. You know, Homer, where I quoted this morning. Guy didn't know how to deal with his cravings and addictions. I quoted him about, what do you do when you come by the sirens? You remember that from the Odyssey? You know, Ulysses tied himself to the mast. He wanted to hear the sirens call and not crash his boat. That's a big part of what we do here. Freud really was someone who came along as a neurologist, couldn't understand what he was seeing. He developed a theory based upon drives, conflicts, and early life experiences. These things formed a template that you use to deal with your internal world and with people in your life. The therapy was to relive that template and somebody that's with you, a transference, and you could fix the template. You didn't have to keep doing repetition compulsion. The third school is cognitive behavioral. Cognitive behavioral arose really from Descartes, I think therefore I am, ever you live in your cognitive minds. We studied ego psychology when I was in training, and cognitive therapy really rose out of ego psychology. That you have maladaptive patterns of thinking, you have distorted false beliefs about yourself, and once you were able to clarify and confront those, then you were able to stop doing that, and you thought differently and you felt differently. And I'll tell you the difference between a psychoanalyst and a cognitive therapist. If a psychoanalyst will see you and go, you're crying because you're sad, tell me why you're sad. A cognitive therapist says, you're sad because you're crying, so cut it out. That's not what really happens, but kind of a good analogy. It is the most popular therapy available in the United States today because it is the cheapest. It's the easiest to teach. It is a good introduction to therapy. I have people I see for very long periods of time. Cognitive therapy only takes you so far. You have to go to the heart of darkness when you see folks deeper than that. The fourth theory is system theory. System theory is Jungian. It's based on, it's what a lot of spirituality arises from, based on the idea that we are all interconnected. That's where Jung and Freud broke the collective unconscious. We have within us anima, wanting to emerge. You have to break through the repression barrier so that this will emerge. Your nurturer, your lover, your warrior needs to come out unfettered. And that's the way most Jungian analysis is set up. So, and actually too, it's, if you, I don't know if you've ever read the book Sapiens? You ever read about Sapiens? It talks about the history of the Homo sapiens species. It's primarily described the Jungian theory as it relates to if we were evolved or created, don't piss off anybody, but if we evolved about how our minds developed. And it fits very well with the basis of Jungian psychology. The spirituality is we're all connected. Why do families look the same all over the world? Why do people go through the same developmental phases all over the world? Why do the pyramids in Egypt and Mexico and India look the same? Well, it's the ancient aliens, right? That came in and showed us how to do it. Maybe that's what we saw when we went to build something. Maybe it's all the same thing. Maybe that's the best way to build a large structure that has fallen down too. So these are all factors. So let me kind of regress here for a minute, talk about the current status of psychoanalysis, because psychoanalysis is it's a complicated field. It's changed dramatically since I started into it. I went into psychoanalytic training in the mid-'80s, and it's still based on primarily Freud's original findings. That we have drives, we have defenses against the drives, we have a dynamic unconscious. And those are pretty easy to see, pretty easy to prove. Freud was a neurologist. He was basically a left brain guy. You had a dream, you saw what was in the dream. He broke it down over 3 pages, and it was all spelled out, linear sequencing. That was, Freud was much more with that. He wasn't intuitive like Jung was. Jung again had a falling out with Freud. What was it? It was a Dangerous Method. Anybody see that movie?
Yeah.
That's a good movie. I like that. So, but it was about Freud.
17, something.
Yeah, about Freud and Jung, they're falling out. This was really all there was until in England they started thinking more deeply. Some of the child psychiatrists came in and said, hey, look, there's more to this than this. So the British Object Relations School, and actually now, when I go to the American Psychoanalytic, most of the meetings are Klein, Kohut, and the relationship therapist. It's kind of fascinating how it's changed during my lifetime. But the British Object Relations School is that early life experiences were not one thing. You could not fuse objects because your brain wasn't sophisticated enough to do that. You had good objects, you had bad objects, you had internal objects, external objects. The goal of having a good enough mother was to allow you to have these feelings bounce off of her. But at the age of 4, you could fuse that and be able to evoke the image of the good enough mother, and you would be calm. So that's the idea of unconditional love, and why it's important to have that. You don't have that, you cannot calm yourself. And without unconditional love that you internalize, you have no love to give, some version of codependency, basically. So it's a fairly firm theory. Klein took it much deeper, and I go listen to them talk, and they got, it's a depressive position and the paranoid position, something to that. But they're into having breasts with poisoned milk and penises floating around your head. I got a 1-year-old grandkid. I just don't see it. This kid's walking around, he's pissing on the floor, he's eating rocks, he looks happy as a clam. But this is where you get an argument about theory. So, and it's, can you then take something an adult tells you and project it into a baby? And so there's probably some child people here, so we're talking about that. But people love Kleinian stuff now. The William Allison White folks, they're relationship therapists. They've come to my office, my chairs are Solomanian, you know what that means? They're 45 degrees. So we use this, that it's a way of being able to look out there. And relationship therapists believe that it's the relationship that heals. Now, Kohut was also someone who was big into this, and there's a reason I'm telling all this stuff. So, but Kohut wrote the 2 analysis of Mr. Z, very important historical paper. His first analysis was, his analyst was saying, you're wanting not to beat your father for your mother, and you know that'll hurt your father, and you feel guilty about it. And you're going, what? But you remember Ken Altshuler? He tells the best story, because this is where psychoanalysis got off track. He said his first analysis, back in the early 50s, went to see a classic Freudian guy, and he laid on the couch, started talking, got in talk, so I'll talk, you won't talk, I'll talk. And so it went on for about 3 months, and this true story is hilarious. And finally, the other guy moved, he goes, you can say something. And he said, I'm sorry, it's true. You're trying to eat your way to your mother's shit. Anybody know Ken? He sat up and said, are you talking to me? Kohut was the counter to that. If you said, my mother rejected me, wasn't there for me, and Kohut would say, well, that must have been terrible for you. That's what relationship therapy is. You sit with someone and they talk about things that are very painful, and you then are eventually able to process the feelings and internalize the therapist as a new object around which your conflicts can be analyzed and understood. And that's something to that. I went to, my analysis was 40 years ago, and until about 15 years ago, I still heard my analyst's voice when I was under stress. And I still internalized the analyzing instrument, which was my introspection and free association and his attention to me, which I have internalized so I can do reverie at the end of the day and figure out how to screw my day up. So anyway, so that's what you do with that. You always take it with you. I like Yalom. Yalom wrote about, he's a relationship therapist for the medical students and residents. Read the book, Every Day Gets a Little Closer. Anybody read that? Please tell me, okay. Every Day Gets a Little Closer. So he was classically trained, Freudian, and he had a patient, he was a professor at Stanford, he's still alive. Said, look, why don't we do a year therapy twice a week, and you keep a journal and I'll keep a journal. And at the end we'll compare the journals. And they had one session where he said, I was able to interpret to Miss K her dependency on her mother had interfered with her marriage and had trouble with her at work. I think we're making progress. In that session she wrote, Dr. Yalom was softer today. I feel better. So it's an idea, what is the person getting out of therapy? They're getting both. So Otto Kernberg came in and said, DSM is wrong. He's still alive, works at Columbia. There's not this big, thick book. There are 3 diagnoses. Neurotic personality organization, borderline personality organization, and psychotic personality organization. All 3 of the programs are based on that. I remember the talk is pretty impressive. Now, I did see Otto Kernberg at the American, and he was not at the Klein talk, he was not at the Freud talk, he was not at the relationship talk, not at the gender talk, which is pretty hot these days, by the way, about how gender formed. He was at the Soames talk. You guys know who Soames is? Okay. All current rivers pour into this lake, into Soames. Soames was a neuroscientist from South Africa, who's nuts, by the way. I hear him talk every time he's in the States, who became a psychoanalyst. And what he's doing is breaking down what is actually occurring inside the brain through functional MRIs and deficit studies. And we'll get into Soames here in a little more. These are the talks most attended in the American. Kleinian, relationship therapist, self-psychology was Kohut, and Soames. You can't get into Soames. And I went to Soames about 5 years ago, and an older gentleman sat down on the front row, and it was Otto Kernberg. And I went and talked to him. I actually presented to him once. I presented a case to him. You want to know what he told me? I was presenting a case of narcissistic character disorder that actually Altshuler was supervising me on. And so I presented to Kernberg in front of a room full of people, and he quietly listened, and then he said, well, Dr. Malone, can you tell us your fantasies about raping this woman while you choked her with a rope? And I said, I don't have that fantasy. And by the way, it's kind of out of character for me to have that fantasy. And he said, well, you need to let yourself have that fantasy, it will advance this case. So, you know, I think Otto, you've been in a dark room too long, so be careful you idealize. But 3 years ago, he was listening to Soames about the new neuroscience stuff. Okay, so let's talk a little bit about how does psychoanalysis affect general psychiatry. Now, we've been through, you know, where everything was an analyst, and you weren't an analyst, you were no damn good. We went through the mind-brain dilemma, though I heard that term a lot. We have the decade of the brain. There's now, it's all at this point is merging. General psychiatry is still symptom-based, which I agree with. You get a list of symptoms, you come up with a diagnosis, set a treatment plan based on that diagnosis. There's very often an algorithm. The danger is that they're going to get an AI and CVS mini clinic take our job. They're not careful. Put in your symptoms, they put a diagnosis, and a pill falls out. So, but that's also the deepest field. We deal with mood disorders, addictions, PTSD, stress, family conflict. You have to be trained in all these things to do a job as a general psychiatrist. Give an example here. Actually, by the way, most recent studies show that patients who show up for general psychiatrists, the ones who get medication and therapy do better than the ones who just get medicine or just get therapy. That's just a raw number. So that's National Institute of Mental Health. That's actually worth looking at. But I'll talk for a minute about a woman I'm seeing as a general psychiatric case. So I'll be quick with this case because I've got some other stuff to talk about here. And she came to me because I was in the hospital, and she came in grossly psychotic. Kim Jong-un was dropping bombs on her bedroom. And her mother had schizophrenia, straightforward case. She was on good antipsychotics, but they weren't working. Ended up putting her on Clozaril, which didn't work. Turned out she'd also, when her mother had a schizophrenic break, her father divorced her mother. She went to live with her grandfather who sexually abused her. She didn't like it, ran away from home, got involved with some people using drugs. When they found her, they put her in a drug and alcohol rehab hospital. She has the genetics for addiction to. So this is a case I had. She started thinking of medication management, and we started talking about things that are going on in her life. She's very bright. Had a bachelor's in accounting, working as an actuary. During some of our work together, decided to go back and get a master's in accounting, which she did. She struggled with getting her CPA, which is a hard test, was hospitalized 5 times during this time. and as psychotic as you've ever seen. Was on the worst patient on the worst ward at Millwood. And I used high doses of medicines to get her fixed. I'd be embarrassed saying how much Clozaril she's on, so it's a high dose. As we got further into the work, she talked about her NA program, the recovery program, which was working for her. Her only friends were NA friends because she had contact inhibition, which you get with schizophrenia. Within, she started talking about wanting to date because she had sexual abuse. She wanted to be with a man, but couldn't tolerate the idea of being touched. So we spent a lot of time working with this. Now during this time, she got a job offer, moves up to Kansas City, being around her parents. They're just as weird as they were when she was young, so that was good confirming. We were able to talk through. She meets a man she wants to date, who's a nice man. And we talk about the intimate issues about what it's like to be close to someone and to respond to her own body. Long and short, last month she had a date with a guy that she'd been going out with for a while, a neonatologist, and actually had intercourse, and it worked. Now, what category does she fall into? She has schizophrenia, she has addiction, she has PTSD, she has issues with her work, she has issues with her family. This is general psychiatry, and you have to know something about all these things in order to intervene and be helpful to her. And I have other cases that don't turn out well, so don't think that this is the only thing that happens. But you have to have knowledge in every area that she has problems with, or else you have to refer the case. You know, you can't treat the patient. Talk just a bit about how does psychoanalytic thinking affect addiction psychiatry. Addiction psychiatry has gone through a lot of phases here too. And well, back when I first started this, the people who treated people in addictions were mainly psychiatrists. We went through a phase where it was almost all recovering doctors, the ASAM phase, which is fine. And I know a lot of ASAM doctors are very good. The advantage of having a psychiatrist on the case is you know about mood disorders. There's so many people we mentioned, you know, Charles Brenner, who was a very famous psychoanalyst, was a neurologist. He didn't believe in mood disorders. If you don't have training in this stuff, you won't see it. So we use a biopsychosocial approach. It's an integrated approach. And what does that mean? The biological component, by the way, the latest study came out in the American Journal of Psychiatry. They've identified 22 alleles and 7 phenotypes. What does that mean? 22 different genes forming 7 phenotypes. The phenotypes all have the similar traits. Your tolerance is too high, you don't get sick when other people get sick, and it feels too good. Your pleasure centers over-respond. And what does that mean? Well, I don't know if you guys watch 60 Minutes. Anybody watch 60 Minutes? My daughter's telling me I'm a dinosaur. I watch 60 Minutes. They had the Rockefeller Institute where the guy who did Michael J. Fox gave him his stimulation so he'd get over Parkinsonism. Thought he could help with psychiatry and addictions. And so what he did was he started in functional MRIs in the septal nucleus, nucleus accumbens, ventral tegmental nucleus. And everybody thought, I thought it was septal nucleus, because septal nucleus is the most powerful pleasure center, eating, sleeping, sex. And actually, with nucleus accumbens, he put you in the MRI and show you fentanyl rig or a bottle of Jack Daniels. It had lit up in the same place in every guy, every person. So he took 2 ultrasound waves and crossed them and obliterated the irritable focus. Now you're down in God's handiwork there. Got to be careful. You want to get out of bed or go on a date or eat a steak. But what happened is all these people lost their cravings for drugs and alcohol immediately. Probably the future of our field. It's risky to do. Got to be really good at it. But it also affirmed what we thought all along. This is what is happening. Your pleasure centers over-respond. And once this has happened, it is hijacked. The only thing you're going to want for 1 year after you stop is another bottle of Jack Daniels or another hit of fentanyl. So we have a 1 year program to give you the best chance to survive the first year. Phil's numbers are really pretty close. Is that I think places like this, you know, we recommend what we recommend. We get approved usually about 20 days in the hospital, 7 days for detox, about 20 days total. Another 2 months in the day hospital. It's a 1 year program. And in that 1 year, I don't work for AA, but if you get your odds of being sober double if you go to AA. homework sponsor, doctor for medicine, therapist to talk to. That's your program. 1 year, 4 part like you're in the service. And that's the basics of the program. What's also connected with these genes are risk-taking, pleasure-seeking behavior. You know what that means? Why do you have that in our gene pool? We actually need some guys that can do that. And I always give the analogy, and that's that if you're a hunter-gatherer band and the scouts come over, hey, look, there's a good lake over there, there's some antelope. Oh, good lake over there, there's some antelope in front of it. And so they take the sachem up there, and there's some other guys camped there. And so we need to go on. And a couple of the bucks say, we can take these guys. You need some guys to say that. You need a couple of guys in your group that will say that are willing to take risks. So it has some advantage of the gene pool. So for any treatment to work, you first have to be detoxified. The valiant studies, therapy and medicine won't work unless you're detoxified. Now, bring down the step work. I know we're getting a little later, you want to take your tour, so. First step is acknowledging you have the illness, genetically determined, progressive fatal illness. The only treatment is abstinence. Second and third step is you can't do it yourself. You must have enough self-love to be selfish enough to let yourself get sober. You got to deal with the ghosts from the past, your fear of aloneness, your self-doubt, your resentment, guilt and shame, things you've done, things done to you. Fourth and fifth step are you do your own timeline, share it with somebody else, parallels to psychotherapy. Other steps are mainly reaffirming your higher power, apologize to people you screwed around. Your 12th step is a service step, which basically altruism, if you follow the best outcomes, say, I think it's altruism, voluntary suppression, humor. Those are the people who have the best outcomes. The whole generativity fits in that too. Again, too, the therapy that was done in people with addiction, the same as any other therapy, people I see is, you've inherited these genetic disorders. You must have exquisite self-care not to die of this disorder. Your ghosts from the past very often include PTSD, or others, or we have war veterans here, that they're plagued with nightmares. We have to treat that. We also, by the way, here we also use naltrexone, which we can't get, we have a supply chain issue. We do use Suboxone maintenance, which I'm mixed on that because the 6-month outcomes are good and the 5-year outcomes are bad. Just like when I was doing a methadone clinic down in Galveston and one over at Fair Park. 5-year outcomes are bad with long-term maintenance. 6-month outcomes are good. Now, I will mention too, quickly the SOM stuff. Why is it so important? What he found on functional MRI is there's 4 separate drives that people have, and you can demonstrate them in the MRI. There's the seeking system, which is involved in lust, play, caring. There's the anxiety system, where something's going wrong. The anger system, you need to fight somebody. And the panic system means you need to run because something bad's going to happen. This is all open stuff. The SOMS book are The Brain and the Inner World, and the better book, the one we teach from, is The Hidden Spring, The Origin of Consciousness, and I taught that course to the senior candidates in the Institute 2 years ago. We're going to teach it again next year. So it's, if you want to know the meaning of life, that's it. I'll give you the quick on it. Our brains are designed to recognize patterns and make predictions. If you recognize you need to make an action, it goes to your periaqueductal gray matter, which determines pleasure or unpleasure. It says that you need to make an action, go to your superior collicula, causes an action, your eyes look at it. You always look at people's eyes when they play poker, when they're going to take an action, and you make a decision based on survival. And that's, book this thick, but that's the end of the book. Now, having said that, I'll talk way too long. Do we have any questions about this before we take a tour? Too much information? So,
Yeah, all evening we had questions.
well, I would say too that Dan and I talked about Greenson. What Greenson famously did, he did tell Marilyn Monroe, he was in Los Angeles, that she must quit being famous for him to see her, which she couldn't do. It'd be trying. But when I was at Timberlawn, we saw these rich famous people. We told them we gave you 3 days to take your narcissism at the door and be Fred, or else we're not going to treat you. We sent them out. He treated her with barbiturates for her hysteria and her PTSD. The stories that she'd show up in the emergency room, hysterical. He'd come in with his black bag and shoot her up with barbiturates. You know, remember, she died of barbiturate overdose. They could tell because the autopsy showed that her abdomen was blue. And so I always think the rich and famous get the worst treatment. So that when you treat them, you have to treat them like anybody else. So, any other questions?
Playing devil's advocate
Yes.
for Marilyn Monroe. I think she passed away, I want to say August of 1962. I just turned 14, and it was a setback that lasted for years.
Are you over yet, Dan?
Yeah, it's my tragedy, but it was an ultimate tragedy for Marilyn Monroe. But if we think about the last several years of her life, and Dr. Greenson using rates, the late 50s, early 60s, we did not have in psychiatry very many good, better options then. Although you argue that, with Thorazine and 55 and let's see, it's Nipramine 56 or so. Anyway, I guess to ask you, could Dr. Greenson have used a better medicine, although he didn't have very many choices, and whether or not he was so steeped in his psychoanalytic training that he maybe was not as up at the time. He would have been considered a foremost psychiatrist, but is the psychopharmacology just not at the level that maybe others had at the time?
And almost everything you're saying is true to some extent. That he was a psychoanalyst, he thought interpretation alone would fix her. I remember I knew friends who worked at Chestnut Lodge that said if you can't cure a schizophrenic with interpretation alone, affirm to somebody who can. That was the mantra around there. And you ever try to cure a schizophrenic with interpretation alone, good luck. He also didn't have a good knowledge of medication. I don't know what I would have used. Where she was a good candidate for, when I was at Timberlawn, my unit was a year and a half. And we didn't call it EMDR at the time. We do relaxation hypnotic techniques. And we had a lot of patients who had severe trauma and would be triggered. And so you taught them how to be able to calm themselves and get recentered. And after about the 30th episode, it loses its power. And that's how therapy works. You sit there with them, you help contain the intensity of the experience, then you give a narrative afterwards, and over time it loses the power. So you need a treatment like that. Managers, a manager's clinic, you stay for 3 years, you're only staying a year and a half. You still go to Austin Ridge for $60,000 a month, they still stay there for 2 or 3 years. It's for people who need a long-term contained environment. If she was here today, I don't know what I'd use, a little Seroquel, a little gabapentin, probably some Prestique or something, and we could help her do this, get a little praises in with the nightmares. You still have to do the therapy work. The therapy work is done one-on-one with somebody who'll sit there with you and go through every page by page, like the recruiter tape for the Kennedy assassination, of what happened to you. That's what I do in my office when I'm not here.
So we look back at her, and we're thinking about 60 years ago, and we think that the good psychopharmacological choices were few, and we think that it's an ultimate tragedy as in terms of a part of what Marilyn Monroe needed.
Well, how many people have you heard of that got bad treatment and died? Rich people, poor people, they just didn't see the right person. And I don't know everything, I promise you. They call me out of retirement to come here because find people with good training. So you got to think about getting training, get good training. So, and the reason I ended up getting, people ask me all these different, board certified general psychiatry, addiction psychiatry, psychoanalysis, is because I see people I couldn't help and go refer them to somebody else. Some don't know anybody else. I need to figure out what to do. And so, it's over time I accumulated these credentials, but I'm no better clinician than anybody in this room. I just wanted to not have to refer people out, or sometimes refer them out and they don't go. And you hear about what happened to them, it didn't end well. You know, so it's, if you're gonna take them on, make sure you know how to treat them, and treat what may be going on. Some of the stuff is not as hard as you think. If we had time here, I would hypnotize everybody in this room. Take me about a minute and a half. EMDR is a hypnotic technique. 5 brain states. There's delta when you're asleep, theta when you're dreaming, beta when you're awake, lambda when you're in a math problem. Get people alpha rhythms. Get people alpha rhythms, then they can tolerate feelings and not get overwhelmed. It turns off your limbic system. This is simple stuff. Been doing this. I learned this from Galveston in the 70s when I was in medical school about doing that. That's what EMDR, hypnotic technique, or transcendental meditation, yoga, all that stuff. You're trying to get alpha rhythms. So, and once you learn the technique, you incorporate it into what's going on with the therapy work. Learning how to treat trauma patients, yeah, you do have to spend time with it because you have to be assertively neutral, so you cannot be terrified of what you're hearing. You can't be overly seduced or titillated by it. You can't be like CSI, you're interested in, well, this is exciting, this person's got shot. You have to be able to sit close to the person, and I think Todd was right about this, and feel and contain their feelings and empathically respond to them. But most treatment is a blend of all these things. Every person I see is on a different regime of medicine. Their therapy looks different than the person who came in office 5 minutes ago. It's always done differently. But it makes it an interesting field. If you go through this for you young folks, your residents and medical students, this is the most interesting thing to do there is. No dull sessions, no dull days. Every day is exciting. I wake up every morning happy to come in. Marilyn Monroe, one of probably hundreds of people got bad treatment. And somebody's too starstruck or, you know, too poorly trained to know what to do. Greenson, I think, tried the best he could. And you got the Greenson book, which I still have on my shelf.
1967.
It's
Required.
Well, required reading, so. I'm ready. Everybody have anything you want to say or ask? Yeah.
I had a question. So we already know that the introduction of medication plus psychotherapy has a greater outcome than either alone. Have you ever studied whether or not the psychotherapy from that same person that's prescribed their medication does better than, let's say, for instance?
Oh yeah, it's far and away. That if the same person is giving the medicine due to psychotherapy, now by the way, the patient will not take your medicines unless they trust you and feel like you care about them, okay? But the person doing the therapy is the same one giving the medicines. There's a bonding that occurs, a trust level that occurs. I spend a lot of time explaining what medicine I'm given, why, what I think is going to happen, and they're much more likely to be compliant. Deborah, what's the number? Like 2/3 of people don't take their prescriptions? Some crazy number?
It's more than half.
Yeah, more than half. It's a lot.
They don't even get them filled. They walk out the door and not fill them.
Well, that's why once they get the AI at the CVS Clinic, and you push in your symptoms and go, you have depression, here's your Wellbutrin, they're not going to take it. It's also, this is something else that, and it's a little controversial, but a good study came out because it showed that face-to-face therapy is dramatically more effective than on a TV screen. Well, that's kind of intuitive. You know, you get to see skin turgor, there's some mirroring neurons going back and forth with that person. I smell alcohol, I smell sweat, I smell BO. There's something that occurs in the room with somebody. In fact, American Psychiatric, ethically, you're supposed to tell them that TV therapy doesn't work as well. And in Psychoanalysis, that's sacrosanct. You must tell them that you'll do it on TV or telephone, but it doesn't work as well, because it doesn't. It's not as effective as old-fashioned stuff. My office is soundproof walls. I sit in a chair and I talk to people. And as eat medicine, I prescribe it. So, and you better know what to do with the medicine. That's kind of the point. You gotta follow this up. Other questions? Yeah.
Just quickly follow up, because I thought about that in theory, but I've been looking for studies to suggest that that is actually empirically true.
Yeah, and I don't know where it is. This is sort of like Dan. I read so much that I forget where I read it. But there actually is a study that shows that face-to-face is more effective than doing it online. And there's another study that shows that why do people take their medicines and others don't is because they think that the psychiatrist likes and cares for them. Deborah, can you help us on this?
Well, what I was gonna say is, when you think a lot of the pharmaceutical an amazingly high percentage of people having some response to the placebo. Why is that? Because the way the studies are structured, those patients are interacted with in a caring manner, which is like supportive psychotherapy. And so and we don't see that in other areas of medicine like we do in psychiatry. So that may be part of your proof right there.
And I'll say this too, is that I don't know when someone comes in what is causing the symptom. Somebody comes in, okay, doc, I'm depressed. Well, I'm fighting with a wife. Okay, so we'll start working on it, and we do therapy, nothing happens. I give them a little prestige, and hey, they work out and they quit fighting with their wife. Now, I will say, in the addiction field, you quit drinking and 2/3 of symptoms go away. You're not fighting with your wife, you're not having sleep disturbance, whatever. But I have people come in too, and they look for the world like that they need to be on medicine, can't sleep at night, or sleep disturbance, or want to kill themselves. Give them medicine, nothing. And 6 weeks later, their grandfather abused them. And we go another route, the treatment goes another route. Because you have to be open to the change as it goes. Every case I see like a novel, I don't know how the novel's gonna end. Yeah.
I actually have a question for you.
Yeah.
With all you have a lot of experience of doing a lot of intensive therapy analysis with patients. Have you run very frequently, do you run into patients who are diagnosed with, for instance, borderline personality disorder, and as you get into the work with them, you find out they have a lot of PTSD symptoms, and when those are resolved, it's like the borderline.
You should know better than ask me a question like that. The truth is, borderline personality means you don't like the patient, don't want to treat them. You cannot diagnose borderline personality with an untreated mood disorder or untreated PTSD, period. You get them on proper medicines, treat their PTSD, and they're still having effective opposite relations, then maybe the borderline. I disagree with Kernberg on this, by the way, but he thinks it's a fixed personality disorder. I have seen people who fit for borderline, very often they're histrionic or it's goal-directed. That have worked in their house. But the other thing I tell people, I never anybody's untreatable. I'll tell a quick story. You got time for a story? This was in the 90s. It's a funny story. Sorry.
Where's the rush? I want to hear the story.
I was in Irving, and my wife was my secretary. Gary, you come out here. So I go, what's going on? And there's 2 guys, they're dressed like men in black. I said, are you Dr. Ball? I said, we need to see you. I said, oh, shit, what I do? Thank you. I'm sorry, I didn't mean it. So I go back, and they're federal marshals. And said, we have someone come down here, and he actually was running a diamond store in New Jersey, which didn't sell diamonds. He was selling cocaine. He was with Gambito's. You ever heard that name? It said, we want you to see him. You can see him as much as you want to, charge whatever you charge, 1 year. Now, you're supposed to go, please leave. Our friend Dr. Malone, who has the little risk-taking gene, said, yeah, it sounds good to me. Apologize. Look at my family, I'm half Irish and half Czech. We have the same risk Phil's talking about. So I started seeing this guy, and he was a pure sociopath. This is the most pure sociopath I've ever seen. It's amazing. And it's a difference between a sociopath and say someone who has, PTSD is someone with PTSD will act out something or repetition compulsion that was done to them. This guy didn't have any of that. And basically, I believe that the highlight of your amygdala is too small, so you do not have empathic responses to people. So if I wanted some coffee and Deborah was in my way, I would just kind of step on her head and go, get out of my way. And I would not take pleasure in hurting her. She would just be in my way. And that's what this was like. And he talked about killing people and stuff. And actually I saw him, and he got a girlfriend, was going to kill his girlfriend because she turned down a pass and know that you don't do that, you don't whack people. So, give him advice. Because he wanted to be a normie. And saw him for a year. Now the trouble is, had the Gambino found out where he was and found out I was seeing him, they would kill me and kill my family. So it was a terrible idea. Don't do this. I still have the card from the U.S. Marshals. But we're talking about what job he should get. He started to be a food taster, and he started yelling at people if food tasted bad in the restaurant. So he knew sales. And so I helped talking about it. He got a job working for Big Tech's mobile home in Mesquite. And within 6 months, he was the top mobile home salesman in Texas. He said, "Doc, just like moving cocaine." I didn't break up with his girlfriend, by the way. And it was, a horrible sociopath. I made him into a smoother sociopath, and he quit killing people. So, and they came back again. I saw 2 other people and go, they were way too much over my head. They wanted to kill people now, and so I just said, I can't do this. So, my wife was displeased with me for taking on the case. They paid well. Anyway, you got to be out here. Any other questions? Any comments? I'd never give you a microphone, so.
Oh, you did fine.
Okay. Does anybody have anything else on this?
I think Philip is going to want to say a few things. We are the Tarrant chapter, TSVP. I'm going to make this business part of the meeting minimal. It's April 30th is a turn in the chapter year where we need to have officers for the next year. And I would entertain a motion that we ask the officers of 2023, 2024 to stay in place another 1 year.
So moved.
Is there a second?
Second.
And is there discussion?
We are grateful for your service.
Oops.
Fearless leaders, you're doing a great job.
Way too much altruism here. Okay, what passes is a quorum of active members, and so we'll take a voice vote. All in favor say aye.
Aye.
All opposed say no. Motion passes. And unless we have some new business.
Let me say one last thing, because I was going to stay here and have some dinner. The Marilyn Monroe room, in case you're wondering, anybody have any curiosity about this? Is that, yes, you go down for the pool, on the far end on the left, it's the room on the corner, the big room, the primo room. So, and I finally got someone to tell me after I kept asking, so, but, so, whatever voyeurism that does for you, I was curious, so, yes.
I guess I do have a question. When you talked about what this place was, is that people came here and drank, and I thought it was supposed to be a rehab place, a sailing bar. So what was it?
It was a spa. It was for rich people to come and get drunk and get a foot massage and soak around in the tub and whatever.
It's part of the Neiman Marcus collection.
Yeah.
So it was in the catalog. You could sign up, you could send your wife here.
I see.
Or your girlfriend. So just don't tell your wife. That's not the point. But it was famous in Fort Worth. No one could find it. This is an industrial area. Nobody knew where it was. So.
Okay.
But I tell you the advantage to it is that people come in, Michael, and they don't complain about their bed. They don't complain about the food. And all of us worked in hospitals where, they go, this place is filthy. The bed's small, food bad, and we don't get that here. And that I don't care about that. I just don't want to hear about it. I talk to you about life or death issues and. Just what we can do they got, their wife's leaving, they're losing their job, their kids don't want to talk to them. That's what I want to talk to them about. I want to hear that the food's crappy, so. And I eat here too, this is good food, so anyway.
Okay.
Yeah, it's a very nice meal.
Yeah.
Thank you.
So, on the third Wednesday of every month at our supportive housing, we have the DFW EAPs, the Employee Assistance Professionals. They're all therapists. That's open for anyone that'd like to come if you'd like to be around a therapist. Third Wednesday, lunch is served, and you're more than welcome to come if you'd like to be on that mail list. I'll make sure that I get. Dr. Dan has my contact information. welcome to come, especially if you just want to be around therapists for a while. Maybe you don't. Does everybody know Dr. Malone pretty well? Do you guys know his history? Know about his little adventure in Alcatraz?
Tell us.
Do you want to tell the story?
Please tell the story.
So, Dr. Malone,
Well, I'll tell it real quick.
Tell the story.
You know, I'm actually not crazy, in case you're wondering, so.
Let them judge after the story.
Yes, but one of them mentioned too, you know, I still do my liver and brain group every other Tuesday for the medical students, and the residents are welcome to come. I do an educational group about liver damage and brain damage to the patients. They call me the Grim Reaper, but regardless. I'll tell you a quick story on this. I play basketball every Saturday at the 30-year geriatric death match. And I was a college athlete. I work out 6 days a week. Thank God I do. I had a stent put in a couple of months ago. Said I'd be dead if I hadn't worked out every day. So 95% closure on my left anterior descending.
Oh, no.
I'm alive. I walked out of the hospital. So regardless, so I'm playing basketball, and it's old men. And we have some people here that aren't men. Are you aware that old men know everything? And if you don't think so, just ask them. And so one of the guys we were talking about the criminal justice system. And he said, we should never close Alcatraz. It's the most perfect prison ever. No one ever escaped from there. It's impossible to swim from Alcatraz to San Francisco. And I said, this guy, he played Division I. He played for Oral Roberts and went to Elite Eight. He's a good basketball, he's a better basketball player than I am. And so I said, wait a minute, you know, I know guys that swim. People swim all the time. I said, hell, I could do it. And he said, and I have to say this, so please, you know, said, you old fat fuck. You couldn't do that. His assessment of me was correct, but he does not get to say that. And then he said, I'll bet you $100,000 you can't do it. And I said, you're on. There are other guys there.
100,000.
And then he said, you don't understand, I have $100,000. I said, I have $100,000 too. Now, by the way, I didn't check with my financial consultant, but I have $100,000 too, and you're on. So he couldn't back down. Now, quite honestly, I couldn't have a $100,000 bet with a friend. We lowered it to a reasonable bet, $2,000. You know, you're playing poker.
Sounds like that.
Somebody bets $2,000. You know, nostrils flare, eyeballs go, okay, it gets your attention. Now, it turned into something crazy. It was a crazy thing I took part in, because we had 10 people go out for this event. Now, he challenged me in June. I said, choose an 81. I said, for $100,000, I'd swim it naked in the middle of the night with a rear brush tied to my feet, which I would have. But we agreed on 2,000. I'm sorry, the story's pretty weird. So I let him choose a day. He chose November the 11th, the worst current day and the coldest day of the year. Said, okay, but he gave me 4 months to train. I was a Division I athlete. I swam at SMU. I was all-state in high school. So I swam 2,000 yards a day, 4 days a week for 4 months. It was stupid on his part. But regardless, we go out there, and people bet for me, people bet against me. My kids are there to bring back body parts. So, you want me to finish the story? Is this too much? Okay, I'll be quick. So we get out there, and I have to get a permit to get the guy take me out this stupid racket, $500. So one comes out and goes, which one are you swimming? And points to one of my friends, a good basketball player. And he goes, not me. Points to one of my friends and goes, I can't swim. I said, it's me. He goes, sir, I'm concerned for your safety. Thank you so much for your vote of confidence. So regardless, we get out there and get in Alcatraz, and I'm looking at the cell block where Al Capone got, almost died of neurosyphilis, and then all the people wishing they could do this, none of the prisoners could do it. And so I jump in the water, and it's 55 degrees, good Christ. And it was also native style, no wetsuit. Because the wetsuit is, all my buddies said, don't wear a wetsuit, it's a parachute. You need to scoot across, so it's okay. And so getting to start swimming, and there's 2 currents, eastbound current takes you over toward Oakland, and the westbound current. And I'm just turning away, and my little Transamerica building, and next thing the horn blows, I look up, and I'm almost at the Oakland Bridge. Oh shit, so.
Oakland Bridge.
So I managed to turn, swim through a warm place, which is not good because that's where the sea lions hang out and the great white sharks come to eat the sea lions. Get closer to shore. It's only a mile and a half, so it wasn't terrible. And so the westbound current is going like a log flume to Six Flags, takes you under the Golden Gate Bridge to Japan, so. But, you know, I'm good swimmer, so I'm pushing it, and I'm looking at the chocolate factory, that's where you get out. And so I finally pushed through there and, pulled up on shore. I was very humble. I flipped the guy off, beat my chest. And so that night, he had to give me $2,000 a dinner. So it's a fun story. It's fun. Anyway. I knew from minute one I could do it. And it's just, I can't get my bet anymore. It's the best thing ever happened to you is like you're sitting on a Royal Slate flush and somebody starts betting into you. That's really what it was. There was no way I wasn't gonna do it, but it was a fun story. And never don't laugh at it. I'm not crazy. So anyway.
You know, I just have to tell you, what I told Roger when you were speaking about it, he goes, I have to go because I love hearing about the alcohol.
Well, and by the way, there is a movie. The movie went to 3 film festivals, and you get, and it actually went to one in San Diego where it almost won Best Picture. But if you have an interest, it's only a 6-minute movie. It's really stupid.
Is it on YouTube?
It's called American Odysseus.
Okay.
American Odysseus. And so you'll get to see me in a tank suit. It's a very traumatic experience. So. Because I am an old fat whatever. So. That's probably enough stupid stories for me.
So from now on, every speaker for the chapter will have to swung from Alcatraz to Psychotherapy. Eliminates abuse. Okay, Phil? Sorry.
Yeah, if anyone would like to go for a tour, I'm happy to give everybody a tour of the facility.
In the pool on the left, the big room.
Yeah.
Big room on the left.
Just there. And otherwise, thank you very much for being our guest.
Thank
We
you.
really appreciate it. Thank you.